A sling works, and a lot of people have the misconception that it's a bladder sling, but it's actually a urethral sling. It's something that helps hold the urethra in place. For the most part, it involves a small incision underneath the urethra through the vaginal wall, and then placing a supportive strap or piece of mesh underneath the urethra and anchoring it in, either through some ligaments that exist outside the urethra and sometimes even going through the groin area itself. Typically, we expect slings to be permanent. In other words, they should last a lifetime. If they're placed properly and they hold and scar themselves into place in the correct way, they tend to be there permanently, they don't dissolve, and they should work forever. The type of patient that generally benefits from a sling is those who have either pure stress incontinence or a mixed incontinence. We don't generally recommend it for urgent incontinence because that's more of a functional problem. The type of patient basically can be anyone who experiences the stress type of incontinence episodes that can happen, again, with day-to-day life. A lot of it has to do with the degree of bother that a patient has with it. If it's something that is just infrequent or doesn't happen very often, they can oftentimes respond to things like pelvic physical therapy. But at any time that people experience this on a regular basis, I think that the surgical approach typically gives them the best results. Typically, we expect patients to have improvement in their stress incontinence. Does that mean that they're going to be perfect? In other words, they could sneeze with a full bladder and nothing's going to happen? Probably not. Typically, what we like to inform patients is that this is going to improve it probably a good 90%. But if we try to make it perfect where you don't lose urine at all, no matter what the situation, oftentimes it can be too tight and then it may make it difficult to urinate. So the expectation should be that this is going to cause a significant improvement, but there may still be some occasional episodes where urine might leak in unexpected situations.